Morning, good afternoon. My name is Dion Namisa. I would like to welcome his Mr. President to in this important introduction, Mr. Bill Clinton. I just want to say people with intellectual disabilities is in our country, back home, been neglected. They don't know. The parents are putting people with intellectual disabilities aside because they think that they are not capable of doing anything. So I am here today to break that stigma, to say that we as an intellectual disabilities, we are capable of doing everything that we can do. So I want to say that what I mean by that is what you can do. I can do it 1,000 times much better than you can do. So I would just like to welcome His Excellency Master Bill Clinton to the podium, please. Master Bill Clinton, I thank you. Thank you, please. Thank you very much.
So Dion, among other things, has some serious muscles there. And I thought he did a wonderful job. Let's give him another hand. He was great. I want to thank Tom Golisano for being the founding sponsor of CGI and for almost 30 years of commitment to nonprofit organizations in upstate New York, serving people with developmental disabilities. He has given away in that time, just to upstate New York, more than $14 million. Today, when we heard from Tom and from another Special Olympics athlete, Loretta Claiborne, about Tom's new commitment to promote and fund health care for those with intellectual disabilities, a commitment that will be completed in much less time with an investment of $12 million, I realized that the CGI had not adequately represented this community before. And I was regretful of that and happy about this day. So I'm grateful to Tom for two things. First of all, without him, CGI wouldn't be here today. And secondly, just because he cares, he's corrected a serious error in our commitment lineup over the years. There are nearly 200 million people worldwide living with various intellectual disabilities. But because of social stigma and other factors that isolate them, in too many places they remain a profoundly marginalized and hard to reach population, often nearly invisible to people who should be trying to empower them. So I am personally profoundly grateful to my friend Tom for championing the need for greater global cooperation on this issue, and I want to thank Tim Shriver and everyone involved in Special Olympics International for using the power of the grassroots movement that the Special Olympics has become to provide not just sports but life-changing health care. This Healthy Community Initiative will help to raise the profile of the health disparities still facing people with intellectual disabilities and help to generate cooperative solutions. It's a good day. Good day at CGI, and a good day for the people who will be helped by this commitment around the world. I'd like to ask Tom Golisano to come up and say a few words.
Do we have the athletes come up on stage?
Okay. Come on. Go ahead. You want
Jim, come on up here.
Well, thank you, Dion, Mr. President. Dion, your story, like the story of many other millions of people, are why we're here today. Not only have I been an advocate and supporter of services for those with intellectual disabilities for much of my life, I'm also the founding sponsor, as Mr. President Clinton mentioned, of CGI. Firmly believe in the convening power of CGI to solve problems on a global level. This is why I chose to make my commitment and my announcement at CGI. It seemed very appropriate. This is the place where world leaders and international organizations come together to turn ideas into action. However, even though much has been accomplished by CGI members over the past 8 years, I believe this is the first time this issue, health disparity for people with intellectual disabilities, has finally been given prominent attention at this conference. It's the first time people like Dion and Dustin, you'll meet in a minute, and all of those who have an intellectual disability, they've been given a face and a voice on the world stage. I have a family member with an intellectual disability, so I know something about the difficulties a family faces when trying to find a qualified doctor or a dentist or a clinician willing to treat their loved one with a disability. And think about this, if that's difficult to accomplish in the United States of America, you must know it's much more difficult to accomplish in other parts of the world. So I'm pleased and proud to partner with Tim Shriver and Special Olympics International to address health disparities for people with intellectual disabilities. I've become familiar with Special Olympics programs over the years, particularly with their Healthy Athletes Screening Clinics. I believe Special Olympics is the perfect partner to carry out the Healthy Communities Initiative and expand needed health services for those with intellectual disabilities on a global level. I hope my gift will encourage and leverage the resources of others. I'm confident we can together improve this situation and make quality health care services more accessible for people with intellectual disabilities. And at this moment, now I'd like to introduce another one of our special athletes, Dustin.
Thank you, Mr. Gazzano, for that wonderful introduction. As he said, my name is Dustin Funk, and I've been an athlete for the past 16 years. And Special Olympics has changed my life in many ways. It gave me self-esteem, helped me find friends, and is a second family to me. But Special Olympics has also saved my life through the Healthy Athletes. In 2004, I went through the Healthy Athletes screening at my local summer games in California. And a volunteer there goes, Dustin, your teeth are in bad shape, and you need to go see a local dentist in your area right away. And I was blessed at that time to have my coach standing by my side, where right when we left that Special Smiles tent, he gets on the phone right away to his dentist and goes, I have a Special Olympic athlete who is in need of some help. Can you meet him? And his dentist says, yeah, bring him in. So I go to his dentist, and he does x-rays and everything, and he goes back into his room. And so I'm waiting in the chair for a couple minutes, and he comes back in, and he says, Dustin, brace yourself. I have some bad news for you, but don't worry about it. I know how to fix it. And he goes on to tell me that I have gum cancer forming in the upper left side of my mouth. And at that time, all I could say, if it wasn't for that one volunteer in Special Olympics, I would not be standing here today in front of all you showing my $1 million smile. So it is because of Mr. Gazzano that our health care for people with intellectual disabilities will get the much recognition and desire that it needs. And the health care that we cannot get will be opening up their doors. And with his support, we athletes have a gift now to share, and we deserve a voice. And I hope that many more people out there follow Mr. Gazzano's lead, so we can educate the medical care out there to let people with disabilities deserving the same right that other people do. Thank you. Now it is my honor to introduce a Special Olympic parent who has a very good story, and he comes from all the way from Jamaica, Vicky Pear.
Good afternoon, everyone. Mr. President, Mr. Shriver, Mr. Golisano. It is indeed an honor for me to be here today to represent my country, Special Olympics Jamaica, and Esther, my daughter, my shining star. It has always been very difficult to find doctors who would treat my daughter as a person and not as a child afflicted with Down syndrome. As a baby, Esther had respiratory problems, and every time I took her to see the doctors, her problems were never completely addressed. As I always heard, well, that's how it is when you have a child with Down syndrome. One doctor was even good enough to tell me, forget it. It will never walk or talk. Just put it in a home and have another child. Trying to get health insurance for her was a disaster, as the forms I had to fill out asked what sort of mental disorders she had. Well, I refused to answer that question because, as far as I'm concerned, Esther is one of the most sanest persons that I know. Finding a doctor, a good health care provider for her, has been a major task in my life. Even a professor that we dealt with treated her for 9 months for a urinary tract infection, when all she had was a simple yeast infection fixed with 3 tablets. The last set of meds he gave her nearly killed her. And thanks to God, we did find one doctor just last year, and Esther will be 26 years old next month. He treats her like she's a person, that she matters. Healthy Athletes opened my eyes as to how a person with intellectual disabilities really is supposed to be treated. I do believe that without Healthy Athletes, Esther would not be where she is today, and she definitely would not be as well as she is or as healthy as she is today. They have screened her eyes, her ears, her teeth, and her feet, and have given me good advice as to how she should be treated. I have had the pleasure to work at Healthy Athletes health screenings, and I have seen firsthand just what a wonderful impact it has on special persons, especially in Jamaica, as we have close to 4,000 Special Olympians, 95% of them coming from the poorer communities. And some of them have never actually seen a health professional before in their entire lives until they are fortunate enough to attend Healthy Athletes screenings. Healthy Athletes is an amazing program that brings promise to so many. And I would like especially to thank Mr. David Evangelista, who introduced Healthy Athletes to Jamaica in 2005, and for his continuing and never-ending support. Thank you very much.
He's running up here, but I want to introduce him. The architect and the leader of the Special Olympics International, Tim Shriver.
Thank you. Let me begin first by thanking President Clinton, not just for his leadership today. There are very few people who would stand up at an event like this and recognize a gap and say, my guess is that these are the first people with developmental disabilities, intellectual differences, who have ever addressed this gathering. And what an extraordinary statement about how much we have to work to overcome blind spots that we all have, and what a great tribute to the President that he stands here to say the doors are now open, and this will never happen again at CGI. So thank you. I could, as I'm sure many of you could go on and on about President Clinton, the first seated United States president ever to attend a Special Olympics event, has been to our World Games on several occasions, championed within his administration the commitment to opening the doors of health care. The first funding for our work came during the Clinton administration from the Centers for Disease Control, which we have been partnered with for almost a decade and continue to try to work with to learn from the Centers for Disease Control. But from a personal point of view, Mr. President, my parents, who have left us, both of whom were such huge admirers of yours, and both of whom saw you and saw in you so much of what was great about this country, and more than great about this country, great about political leaders. You were so kind to them in ways that were not necessarily certainly not about politics. So I want to tell you that 50 years ago, yesterday, my mother published an article in the Saturday Evening Post. Her brother at the time was the President of the United States. He had run for president and been elected president, and his family had been pictured all over the world. And there was one person in that family who had never been in any of the pictures. And 50 years ago yesterday, she published an article, the cover of the Saturday Evening Post, that was titled "Hope for Retarded Children," in which she announced that the President of the United States had a sister who had an intellectual disability, in which she announced that they were not ashamed of that sister and would no longer tolerate a world in which that sister was treated any less well than the President of the United States, and in which she said that we can at least begin by learning to play together. We may not be able to solve all the problems, but maybe in one country it's a cow per person, and maybe in another country it's just a soccer ball. But we can learn to play together, and we can end that stigma once and for all. And I don't know anybody who is more proud today of what's going on here at CGI and the legacy that is hers, which is now Tom's. As I said to Tom a year ago, I opened my computer about 9 months ago, and one of our volunteers from Malawi sent me a photograph. It was a photograph of an athlete. He, the healthcare volunteer, had gone out to recruit, and the athlete, he'd taken a picture in Malawi, not far from Dion's home. The athlete was tied on a leash with animals. And I took that photograph and I went to Tom quite audaciously and said, I can't look at this anymore. I just can't look at it. And look myself in the mirror at night and brag about Special Olympics has got 1 million, 2 million, 3 million, 4 million athletes. Great. There's 200 million people, as the president said. I said to Tom, I can't look at it. We need a new champion. And it would have been very easy for Tom, with massive commitments he's made to health in Rochester and around the country, very easy for him to say, here's a Christmas card and a farewell wish and good luck to you. But he made this is the biggest gift in the history of our movement. And so from where I sit here, 50 years after the Saturday Evening Post article, we have a new champion. And I use these words, I've never said in my life, that we have a person here who is challenging this community. He doesn't want me to say it, but it's a matching gift, by the way. So, Mr. President, we need another 12 million. I'm not supposed to say that, but hey, somebody's got to raise money around here.
Somebody needs to ask.
Somebody needs to ask. It's not going to be me. Maybe if Loretta asks, we'll get it. I know, right? But I want to thank the Lions Clubs, the CDC, Essilor, Safilo, Health One. I want to thank my team, David, Darcy, Steve Neal, all our team who are here. I want to thank my fellow board member, Kim Samuel Johnson. I was just a few days ago at the Capitol Rotunda when Secretary Clinton recognized, along with Speaker of the House, Aung San Suu Kyi, who was awarded the Congressional Gold Medal. And Senator McCain quoted her as saying that the old adage is wrong, that power corrupts. This is her words. It's not power that corrupts, it's fear that corrupts. And these athletes, Joanna, Loretta, Dustin, Dion, and 200 million more like them, every day have to look the face of fear in the eye. And not far from them, there are large institutions today. Not far from them, there are people tied up today. Not far from them, there are people lonely and isolated and marginalized and humiliated with taunts and playground jabs and bullying in this country and around the world, and they have been hidden for too long. This gift is our commitment to leverage the grassroots power of a global network of people who care. Millions and millions of moms and dads, volunteers and coaches and athletes themselves who care enough to come out and play and learn to play together and to allow them to say, we want health care to be fair and equal. We're not asking for extras. We just don't want to be told when we get to the doctor's office, I'm sorry, there's no room in the waiting room, there's no room in my practice for you. And that's what they're told every day. This is the beginning of our commitment to change that in countries around the world. So, Mr. President, when you came to our games in Japan, you met with many of our youth leaders. And at the end, they were telling you their stories. They were telling you stories of pain and struggle. They were telling you about how they were humiliated in school, not allowed to go to school. 90% of people with intellectual disabilities don't go to school at all. And the Millennium Development Goals, sadly, have not yet done enough to end that discrimination. And they were talking to you, and at the end, you had to leave, and they said, what's your advice? What's your advice to us? And you told this beautiful story of a village in Africa where the greeting, instead of people saying, hello, how are you, they say, in translation, I see you. So I see you is the greeting. And your challenge to them was to remind the world that's all you're asking for. You want people to see you. We've taken it seriously. We've thought about it. We've prayed about it. We've worked on it. We've planned on it. And we're here to say that these faces, these human beings, they deserve to be seen in the doctor's office too. And there should be no excuse for the continuing injustice and intolerance in the medical community around the world. So we thank all of you who've come to watch. We thank all of you who have worked. We thank our new champion and leader, the president. But most of all, we thank Loretta and Joanna and Dustin and Dion, who have the guts, the real grit, stand up in front of a place like this and tell your story and not be ashamed of a doggone thing and say you count, because that's the inspiration that gives us hope for the future. Thank you.
Thank you. Richard Jordan from South News with a question for Dustin. Dustin, the Roman Emperor Marcus Aurelius said that just because someone thinks something's impossible, someone else can't do it. Do you have a role model who was told that's impossible but then went out and did it? Thank you very much.
Pretty much my role model who was the one who got me involved, who called that dentist for me, and that's my head coach, Chuck Martucci. He really looked after me throughout the years and gave me a place to come to safely.
Should I moderate this? Okay. Sure, go ahead. Yes, sir. I guess I should moderate.
It's Dr. Adal with World Liberty TV. I just wanted to find out about the Special Olympics. They wasn't getting coverage with the regular Olympics. What's your feelings with that, and is there anything being done to correct that, sir?
So our focus is we do 53,000 games a year in the Special Olympics movement, run by athletes, families at the community level. That's our most important platform. Thank you, Mr. President. Yes, thank you. So our most important platform is at the community level. It's the Jamaican National Games, it's the York, Pennsylvania Games, it's the games in Budapest that are going on year-round. So 53,000 events a year is our most important platform, and we do need the eyeballs of the world for those. The big events are a big struggle. The Paralympic Games in London got very good coverage in some countries, not so much in others. Our games, which will be held in Korea next year, Winter Games, we hope to get better and better coverage because we think there's an audience, but we haven't yet convinced the media that the audience is as powerful as the more traditional elite sport audiences. That's work ahead of us. Yes? You sure do. You'd like one? Okay.
My name is Irene Hell. I report for The Independent on Sunday and for Irene Hell News. Congratulations on supporting medical care for these people. Sorry, I'm nervous. So, Mr. Golisano, President Clinton just said, you've been the one who made it possible, this Clinton Global Initiative. And now already $70 billion have been donated. I think that's a very good investment.
Thank you. It's not totally dollars, a lot of it is goods and services, which of course are just as important. President Clinton took a
Apparently it's working.
President Clinton took a huge risk in starting Clinton Global Initiative, and he invited me to lunch to his house and asked if I could help. And I said, this is pretty risky. What if we build it and nobody comes? And so on and so forth. But he did a tremendous job of putting it together, and I think it's been one of the most successful public events in the history of mankind, quite frankly.
Yes?
I do have a question. Oh, thank you. I recently saw a replay of the film Judgment at Nuremberg, and one of the most horrible things about Nazi doctrine was eliminating the disabled. And I want to say how proud I am to hear that you're actually supporting health care for the disabled, how inspired I am to hear you speak about your experience with your dentist, and to ask because I have to go to France to give a speech at a conference opposing the resurgence of Nazism, and I'd like to know, is this program going to be in any way incorporated into the United States government program assisting the disabled?
Yeah, well, the United States government has very complex insurance and caregiving programs, Medicare, Medicaid, supplemental Social Security services, and so on. So it's a complicated system in the United States. The good news is that I think the innovations in healthcare, anybody in the disabled kind of worldview would say that the changes into the healthcare law are positive. The elimination of bans against people with pre-existing conditions and so on are very, very positive. So I think the system's moving in the right direction. There are big gaps in dental care in particular. The fact that Dustin could have that oral cancer, that he probably had it for years, that it was not diagnosed and he was not able to see it. These are big gaps, big problems. Eye care, big problem. Cardiac care, big problem. Obesity, nutrition issues, big problem. So there are big problems in the United States. In a way, the mirror image in other countries, we have malnutrition and starvation and all these other kinds of water-related illnesses and so on and so forth. So this gift is going to allow us to expand both in the United States and in the developing world, both. There's no country that doesn't have a lot to do to improve. But in the United States, our work is non-governmental, although we're supported by the Centers for Disease Control and some state governments. Yes?
Julia Miniva, Transterra Media. What else can be done on the legislative level in this country to improve the rights of the disabled people?
In the United States? Mm-hmm. Well, it's a big question. I think the frontier has been in health and education and community living. There are still very, very long waiting lists for people to develop independent living opportunities in the United States. Most people with a developmental difference still wait a long time for the chance to live independently and are typically on long backlogs in state systems. The healthcare systems we've talked about. Education is very much under siege for people with developmental disabilities. They have become something of a lightning rod for people who want to attack waste, and there is waste in special education systems like there are in every system. But we're very concerned in this community about the risk with the upcoming budget problems in the United States at the federal level and state level that many of our people will be reduced significantly in terms of the care they get. I think the most important thing is that we want political leaders to listen to people with intellect. Again, this is a population that's not on the Hill, that's not in state capitals, that's not being invited to testify at hearings, it's not being invited to fill out forms and surveys about the quality of care, the quality of housing, or the quality of community living. We are still a silent community. We're still hidden. And so our hope is that efforts like this will begin to open the eyes of political leaders to this as a gifted population capable of contributing, and that level of empowerment, just the voice, coming from education groups and others that will give them voice, and we hope people listen to them, we think will make a big difference. Yes? Oh, right there.
Thank you. I would like to say thank you to Dion, Luana, Loretta, Dustin, and the mother of the athlete from Jamaica, and all the other moms. Yeah. Because what I see on the platform here is a set of dignified young people.
That's right.
And they're special in their dignity.
That's right.
So what? Yeah, thank you. So in supporting you, I'd like to talk of the narrative of dignity, which would remove disability and disease. Because with dignity, one can overcome. One can do anything. That's what I'd like to say.
Thank you. We sometimes call our movement a dignity revolution, and we play with words a lot. Loretta got us and got the whole world to get rid of the old language of mental retardation. We replaced it with intellectual disability. I happen to like diffability, maybe dignity ability, I don't know, maybe, but different abilities. I mean, this is what science is telling us. I mean, the whole idea that there's one ability and then there's either ability or disability, it's all wrong. Scientifically, you don't have to be a softy to think. I mean, we're beginning to understand the way in which the brain develops and the whole manifold levels of intelligence that exist in people. And, I mean, I don't know about you, but people that saw the plenary today, 24 people came up to me and said, well, that Loretta Claiborne, she doesn't have any kind of disability. And I'm like, you're right, she doesn't. She has a lot of different abilities, but she doesn't have a anything. And none of these people do. And so you're right, the language is something we have to continue to try to change so that we communicate the full dignity of what we're trying to embody. Yes? We have time for one more question. Yeah, and then somebody else has to come in here.
Oh, good. Thank you so much. So, Catherine Cunningham, Ecosphere Productions. And just a short comment on the dis and the negative. I actually started with a colleague and friend, Sportabili in Italy, which was all about ability. So we sort of made that reversal.
Yes.
So I just wanted to focus on that point. It's a great model, and one I'm happy to share later with anyone.
Yes.
The question I have is how much resource might go into providing employment opportunity, because I also have a cousin who's disabled, and she takes great pride in her job. Right. And it's multiple things. I mean, she's actually worked on campaigns stuffing envelopes, so, that could be a great place to put...
any campaign in particular? We'll wait till...
Why not your campaign, right?
Not my campaign.
That's my point.
Thank you. No, I think it's interesting to note, for those of you who are interested in statistics, that we did a study of United States athletes involved in Special Olympics. We found that they were 3 times more likely to have gainful employment than their peers who had not been involved in an organization, or in our organization. Now, that sounds like it's self-aggrandizing about us. It's not really about Special Olympics. It's about what happens when you build a community around ability. Because you get moms and dads and coaches and local volunteers and businesses and Lions Club members, and they're all coming out to play soccer. They're not coming out for a pity party. And the next thing you know, the soccer player knows the manager of the local restaurant, and he's or she's getting a job. And so it's the networks around the affirmation of ability that we believe, we don't know this for sure, we believe have a catalytic effect on employability. Our colleagues in Romania, Christian Ispas, who's here, is working very hard in Romania on using the catalytic networks that Special Olympics has created to promote employment. These are all bottom-up strategies. These are all community-based strategies. Most human rights movements focus on the rights. This is all about mobilizing the human capacity at the community level and trying from the bottom up to use the leverage of human ability to catalyze changes in these systems, and that's why today is so exciting. And yes, final word.
My final.
Yes, please.
Okay. My final word is that, yes, I agree with everything you've said, but you've not said that Special Olympics is not just a organization. Special Olympics is a family. And it puts within the athlete, the person that's connected with Special Olympics, it gives them a reason of self-confidence. It makes them feel like they count and that they're persons. We are a family, sir. Thank you.
Thank you. We're done. Thank you all for coming.